Come back from that Keep Fit segment on general body exercises and still on health. We have a guest in the studio who will be talking to us about the approach of sickle cell management. He is Solomon Adomi. He is the head of clinic and research, Brain and Body Foundation. You're welcome to the studio, sir.
Thank you very much.
It's good to have you.
Same here.
So we'll be looking at the approach to sickle cell management. And then before we do that, I would like you to enlighten us on the origin of sickle cell.
Okay, so as is widely known, sickle cell is genetic. It's a genetic disorder that it is autosomal, meaning the genes are, how will I put it? The genes, no different gene, they are the same actually. Okay. So they are gotten from parents to kids.
Okay.
SS, we have different variants of it. And it's characterized by pain, hemolysis, that's blood cell death. And it's also characterized by the other symptoms that are very much noticeable. So they include, for some people, they include jaundice, for others, pallor, both in the lips and in the fingers. And then it's also characterized by low life expectancy for now. Okay. So that's the abridged version of the whole origin of sickle cell disease. Okay. But it's mostly in Africa and in some parts of Asia and in the South America.
Okay. Yeah. Okay. So what's the current management approach to the sickle cell anemia?
Okay, so current management approach, first off, the most, I would say the most common from my standpoint and in what we see in the foundation, the most common is the complication or symptom is vaso-occlusive crisis. So crisis, pain in maybe the joints or the bones. Okay. So for the first time or the first of approach is to manage that. Okay. Using maybe doctors will prescribe analgesics, that's pain medications. Yeah, they will also tell you to drink water and all those things. And then after that, there is folic acid, there is paludrin. Some people would give vitamin B complex, some people would give vitamin C, and then some others, very few for now, because they need to be followed up by a hematologist. They would give hydroxyurea.
What's that?
It's basically a drug that helps to produce a different kind of hemoglobin. Okay. Right. So, but it should not be gotten over the counter. The doctor has to prescribe that. So that's the current management of sickle cell disease as we know it here in Nigeria and some parts of Africa. For some other people, they would basically, talk about gene therapy. Some will talk about bone marrow transplant.
Yeah, part of those.
Yeah. So these are the various management of sickle cell disease. However, in our foundation where we are, we tell them to take this from the hospitals, and then when they come in, along with what they give them, we give them vitamin C, we give them zinc. Okay. We give them vitamin D, because we have seen from our work that these ones, they help to improve the immune system, reduce the incidence of infection, and then we have less crisis, less visits to the hospitals too. Really? Yeah, so for us, that is our current management approach, alongside what is given in the hospital.
Okay. So for a patient with sickle cell anemia, before he gets to the hospital or to your own foundation, what do you advise him or advise the parents to do at home?
Okay, so
managing that patient.
Yeah, managing the patient. First, we always tell them do not subject the child to extreme temperatures.
Which is either it's too cold or too hot.
It would it may trigger a crisis.
Okay.
Yeah, we tell them to always stay hydrated.
Okay.
Because dehydration is one of the causes of sickle cell crisis too. And then we tell them to any routine medications they are giving, they should be religious with it, especially, for example, paludrin, because we have seen that we are not saying it's causing it, but there's a correlation between malaria and the crisis. So the child gets malaria, tend to see they have a crisis.
Okay.
So I encourage them to do that, and then we tell them take vegetables.
A lot.
A lot of vegetables and fruits. And then we also tell them if they can, you can get what's called vitamin D over the counter, but they should not overdose on it, because everything has a point where you go overboard. Yeah.
So, which brings me to my next question. When you made mention of malaria as one of the triggers of sickle cell anemia, what are other triggers for sickle cell anemia apart from malaria?
Yeah, so like I said, dehydration.
Okay.
Right, and then people tend to what's called put stress together with sickle cell disease, in that when you overstress yourself, when you overwork the body, they mostly come down with crisis. So we've seen that with kids that come to our foundation, for example, when it gets to the exam period, because that includes mental and physical stress, they have to be awake to read their books, their brains are working, and they're going stress. Yes, emotional, mental stress. We tend to see that they come with crisis. So at that period, we tell them, okay, for vitamin C, keep taking it, keep taking the other supplements, keep taking your medications, and then drink lots of water. Because we see that we need to be much more focused when they are stressed than when they are, although we are focused all around, but it's now what's called concerted when they are stressed. And then, so stress, I would say stress is one of the triggers of sickle cell.
So we looked at stress, malaria, dehydration.
Yeah.
Wow. So as a sickle cell patient, what's the life expectancy of that patient?
Okay, so people have different, because authorities, literature, they have different, what's it called, ages that they have put up. So some people, like they say in developed countries, 53 to 60. I think American Society of Hematology says 42 to 47, thereabout. So it varies actually, and it's dependent on the patient or the sickle cell warrior, also I'll say. But from what we have seen and from research, we've seen that some of these kids, about 50 to 75% of kids with sickle cell disease may not see 5. Yeah, it's a statistic, and it's been troubling for quite some time. And it's worse here because life expectancy is much more reduced in this place compared to developed countries because of access to healthcare.
Okay, because I think I saw a patient of sickle cell anemia at the age of 80.
Yes. So I was going to bring that.
What happened in that case?
Yeah, I was going to bring that up. So now, because people are different, the biochemical structure is different, and how their quality of life. So I said yes, the quality of life and their what would I say, lifestyles are different.
Okay.
They tend to have some people would have less crisis. Some people will not even have crisis for a long time.
Okay.
I think I heard of a patient that said she noticed she had sickle cell when she was 30.
Yeah, that was my next question, because I think I've seen another patient that realized she's a sickle cell patient at the age of 30-something.
I've heard of that too. Now,
so what? I don't know. It's not really what made it different from.
Okay. So
and then we didn't see it. We didn't know that person has it until when she was almost 30-something.
Okay. So why she didn't know it's basic. They didn't do genotypic testing on time. Like if they did when she was younger, she would probably have known that she had sickle cell. Anyway, and then even if they did, maybe the test results were wrong. But now we've seen that even with the commonly mentioned statistics, we've seen that different things have added to the life expectancy. In that, first off, there is the globalization and westernization. So they get more access to healthcare, even if in the remote areas it's still limited, but more access to healthcare. And then people now do things that help them reduce crisis severity and frequency, and then more people are living healthier lives because of the knowledge of sickle cell and how to manage it. So yeah, these are the reasons that they would not have, they would live longer than commonly predicted.
Okay.
Yeah.
So your word of advice to patients out there are warriors, because we call them warriors.
Yeah.
So your word of advice on managing themselves during crisis.
Yeah, so I would say first off, dehydration. Dehydration is the problem. So stay hydrated, take what's called vegetables religiously, stick to doctor's advice because they know what they are doing for giving you these meds. And then simple supplements like zinc, although your doctor should tell you the amount of zinc to take, and vitamin C and vitamin D would help. We currently have supplements actually coming in from from India. We're trying to clear it off. So we distribute this to sickle cell patients. So in time, we can, once we are set with the event, we'll put it out there and the people can come and take these supplements free of charge.
Thank you so much, Mr. Solomon.
Thank you very much.
We appreciate you being here. Keep doing what you're doing.
Thank you.
Well, we've been speaking to Mr. Solomon Adomi. He is the head of clinical and research Brain and Body Foundation, and we've been talking about the approach to sickle cell management.